Thank you to the Moving the Needle corporate sponsors, Home Infusion Options and Metro Infusion Center, and our exhibitors, Takeda, Janssen, and Bristol-Myers Squibb. You share our mission of advancing patient care and make events like this and our grant making possible.
I'm really delighted to have these individuals with us. I'm going to start us off by hearing from our colleague, Dr. Sushila Dalal. Dr. Dalal is an assistant professor in the section of gastroenterology, hepatology, and nutrition, and she's an expert in inflammatory bowel disease. She also directs our program for pregnancy and preconception planning in IBD, as well as working very importantly on a condition that you're about to hear about called pouchitis in people who have had surgery for ulcerative colitis. So Dr. Dalal, take it away.
Okay, thank you. And thanks for coming this evening. Tonight, I'll be telling you about the grant that's been funded by the GI Research Foundation. And the grant was entitled Host and Microbial Predictors of Ileal Pouch Inflammation in Ulcerative Colitis Patients. And I'll explain what that all means and why it's important. So why do we want to predict who will get pouchitis, and what is pouchitis, I guess, in the first place? So patients with ulcerative colitis who are refractory to any medications and medications don't work for them, or they develop precancerous lesions or colon cancer and require surgery to treat their disease, have their whole colon removed. At that point, patients have the opportunity to either have a permanent ostomy, where the end of their small bowel drains through an appliance affixed to their abdomen, or they can have the end of their small intestine fashioned into what we call a J pouch. So the terminal ileum is made into a J-shaped pouch that's then sewn to the bottom. There's still an intestinal continuity at that point. And while in ulcerative colitis patients, the end of the small bowel is not involved in their disease and is always a healthy part of their intestine, unfortunately, sometimes once that part of the small intestine is made into sort of a new rectum or J pouch, that pouch develops inflammation. So we estimate, and I don't think we have very current data with all of our new medical therapies, but we estimate that about 15% of ulcerative colitis patients will require surgery to remove their colon for one of the reasons that I mentioned. Of those patients that then decide to get J pouches, about 50% of them will get some inflammation in their pouch. Sometimes this is easy to treat. We give them 2 weeks of an antibiotic and the inflammation goes away. But of those 50% of patients that get some inflammation in their pouch, about 30% will get chronic inflammation. And either they can't get off of antibiotics or they need to go back on IBD medications. And about 15% of those 50% that get inflammation develop Crohn's disease of the pouch. It's not that we had the wrong diagnosis or we missed something. They just developed this new inflammation in their pouch that we didn't see coming. And what we want to know, and what patients would want to know, is, well, am I going to be one of those people that gets chronic inflammation in my pouch? Am I going to be one of those people that get Crohn's? Because if that's the case, maybe that wouldn't be the right choice for them, or maybe we would do something different with their medical therapy right after surgery. So it'd be really nice to better inform patients of what's going to happen so they can make a better decision for themselves. So what's proposed in this project and what we're doing, we want to do is to look at the time of surgery at the end of the small intestine that's going to later be made into the pouch, and find out what is different about these patients in terms of their immune profile and in terms of the microbial community. So we think it's probably a mixture of both. That is probably their underlying susceptibility, that something's different about their immune system. And it's probably something that's also different about the bacteria in their intestine, because we know that pouch inflammation often responds really well to antibiotics. So in this grant, we're going to measure the immune profile of the small intestine at the time the colon was removed and look at the T cell population. We know that there's certain markers that are expressed that have been associated with inflammation. We're also going to be collecting stool at each, the surgery is done in 3 steps to make a J pouch. And then once the pouch is created, and we're going to be looking at microbial products or metabolites to see what is different about the microbial groups there, so that we can better try to predict who will get inflammation and then better create therapies and inform our patients about what may be best for them.